Good morning and welcome back. Today we have Michael Dykes joining us from Piedmont. Thank you so much for being here.
Thank you for having me. It's a pleasure.
I'm excited to have you here. We have a really important topic talking about emergency visits, and do we go to the ER? Do we go to urgent care? What do we do? What in the world do we do? I mean, you're a parent, I'm a parent. We get so concerned about our kiddos, our loved ones. How do we navigate this?
Tough decisions that we have to make at times. So I just want to first say that, again, it's a pleasure being here. I've been a little bit about myself. I've been in the healthcare for over 24 years,
Wow.
11 with Piedmont. So it's been interesting times, especially during the COVID. So decisions about making a choice between urgent care and ER. The ER is certainly a dynamic place. They have all the resources that you would need for that true emergent and urgent care. So when you're deciding on which ones to choose from, you definitely want to make sure that we're always there. We're always open 24/7. Definitely, if you need to come to the emergency room, make that decision and just come on. Whether you need to call an ambulance or have someone drive you, preferably if it's an emergency, please call 911 and have patients or your loved ones come in. So when it comes to the differences between the ER versus urgent care, ER has all of the high-level equipment, CAT scans, MRIs. We have the 24/7 lab, that can run all the different tests.
Wow.
Advanced, so if you're having something like a chest pain, shortness of breath where you can't catch your breath, stroke symptoms, really important. Having a baby,
Right.
You definitely want to.
ER.
Yes, please.
Go to the ER for that one.
Definitely go to the ER, and then so that just puts a little more emphasis on the importance of understanding that aspect of it. If when in doubt, come to the emergency room. When you're looking at the difference between ER and urgent care, the urgent care aspect of it is not as involved as far as their equipment. It's for your coughs, colds, from like the flu, even COVID, unless it gets into respiratory distress. Obviously, that would be more leaning towards the ER. Cuts, scrapes, sprains, strains, anything like that would not considered life-threatening. You definitely want to use the urgent care. They are quicker. You get in and out. They're not open 24 hours. So that, again, depends on when you have your incident or your concern, as the ER is open 24/7.
That's right. And I think it is important to understand the difference between going to the ER or urgent care. I think right now you're seeing so many people with RSV, with the colds, the flu.
Absolutely.
Some folks are getting COVID. And so to have this as an opportunity as we get through this holiday season, I mean, we are in the midst of it right now. You need to know what's out there. What do you want people to know as we go into this holiday season and we are in it? How do they make that decision? What do you want to tell them?
Yeah, so urgent care, definitely for any flu, they can do a quick test for that. Even COVID, RSV is pretty rampant, not only with the pediatric population, but we are seeing it in adults as well. And obviously you would see a physician there and have that. So obviously to prevent all of that is the key. You definitely want to do all of your washing your hands. If you're sick, stay home. Quarantine, just similar to when we were with COVID, because it is a more a respiratory disease that is easily spread. Kids are being out as well, so hopefully that will start to decrease with the kids not at school, but obviously they'll be at home. But just again, hand washing, good hygiene is really a preventive for the respiratory season, as we also have seen.
All right, so remember those tips. Remember, urgent care versus the ER. We'll have all that information on our website, 41nbc.com. Thanks so much for being with us.
Thank you for having me.